Let's discuss extra points, Jinggong, Palace of Essence, and Huatuojiaji, paravertebral points. Jinggong Palace of Essence, location on the back, 0.5 June, lateral to the point, bladder 52. Action, nourishes the kidney essence. So here is the illustration of the Jingong besides the bladder 23 and also illustration of bladder 26. Indications for infertility. Comments. Jingong is used to tonify the kidney and specifically the kidney essence. Nourishes the kidney essence for infertility. Extra point B2, Huatuo's paravertebral point. Location 17 points pair. 0.5 June lateral to the lower border of the spinous processes close to the spinal facet joints. 12 thoracic joint pairs between T1 and T12. 5 lumbar points pair between LI1, lumbar 1 and lumbar 5. Depending on the school of thought, corresponding point lateral to the cervical spine are described as additional Huatuojiaji. How to find? Select points of EXB2 depending on the disorder. Determine the relevant spinous process and locate the point pairs 0.5 June lateral to its lower border. Needling 0.5 to 1 June vertically or better oblique in a medial direction towards the spine. Up to 1.5 June in the lumbar region. The purpose of needling this point is to stimulate the local nerve roots. This means that the insertion angle has to be adapted to the patient's anatomy. Never needle in a lateral direction. Once decay is obtained, do not further stimulate the needle. It is possible to apply electrostimulation. Action indication, regulate and harmonize the 5 sang and 6 pu organs, depending on the point selected. Special features with disorder of the facet joints of the cervical spine. There are often tender points, 0.5 June lateral to the lower borders of the spinous processes. In China, these are needled for chronic disorders of the cervical spine. A oblique insertion, approximately 45 degrees, in a medial direction are used for points on the inner branch of the bladder channel. The tip of the needle will reach the area of the Huatuojiaji points. This enhances the therapeutic effect. Huatuojiaji back filling points. Location, a group of points on both sides of the spine, 0.5 June from the midline in correspondence with the intervertebral spaces from the first thoracic to the 5th lumbar vertebra. So here is the illustration from T1 to L5. Actions regulates the internal organs, benefits the back and spine. Indications for diseases of the relevant organs, backache. Comments, these points are named after the famous doctor Huatuo, who lived during the Han Dynasty. It is thought that he used these points as back transporting points. The action of these points is similar to that of the corresponding back transporting points. However, they are not often used in this way as the back transporting points would be more effective. They are, however, frequently used as a local points for backache and are particularly useful to correct deviations of vertebra. It regulates the internal organs for diseases of the relevant organs. It benefits the back and spine in backache. It points from the 1st to the 4th thoracic vertebrae, treat disorders of the lungs and upper limb. Points from the 4th to the 7th thoracic vertebra, treat disorders of the heart. The points from the 7th to the 10th thoracic vertebra treat disorders of the liver and gallbladder. Points from the 10th to the 12th thoracic vertebra treat disorders of the spleen and stomach. The points from the 1st to the 2nd lumbar vertebra treat disorders of the kidneys. The points from the third to the fifth lumbar vertebra treat disorders of the bladder, large and small intestine, uterus, and lower limbs. The points from the first to the seventh cervical vertebra treat local disorders of the neck. All the Huatuojiaji points treat herpes zoster at the level of the affected segmental nerve. All the Huatuojiaji points treat pain and stiffness of the local area. The Huatuojiaji points were first mentioned in Song to Keep Up Your Sleep. Their discovery is attributed to the great Han Dynasty physician Huatuo, who was said to use them in preference to the back shoe points.